Hello everyone. Today's video is about treatment options for advanced liver disease. Just before jumping into the video, if you don't mind taking a quick moment to please like, share, subscribe, and or post a quick comment on the video, I'd really appreciate it. So thanks in advance for taking a second to do that. And as per usual, nothing I'm saying should be construed as medical advice. This is for informational purposes only. If you need medical advice, please talk to your healthcare provider to get that advice. So someone sent me a direct message the other day asking about any treatment options for advanced liver disease. So say a person with cirrhosis or some other condition where the liver function is really notably compromised to the point where there's really no expectation for the liver to just spontaneously regenerate on its own. And so basically asking, is there anything that can be done besides just waiting for a liver transplant? So thank you for the question. It's a really good question. Even though this isn't really something that falls into the normal umbrella of complex chronic illness, it is something that I think is still be of interest or of relevance to folks who are dealing with chronic illness issues, like complex chronic health issues, because talking about the different agents that can be helpful in a really severely affected liver can certainly have some spillover into talking about options for folks who just want to optimize their overall liver function and within, say, the context of just optimizing detox capacity to help, get rid of different toxins like heavy metals and things like that as well. So I don't think it's just a niche topic, but anyways, regardless of what category you wanted to put it into, niche or non-niche, I'm going to give you my answer anyways. So I've worked with several patients over the years with advanced liver disease. Some folks where they have been given a very short amount of time to live with their prognosis because they're just too far down on a transplant list. Maybe there was a lot of alcohol consumption previously, which lowers them on the puts them lower on the list of eligible liver transplant recipients or whatever it happened to be. And I've actually seen some really impressive results. Some cases just, I don't really drop the miraculous word too often, but I would say near miraculous results anyways. Now, obviously, there's no one-size-fits-all protocol for everyone, no guarantees with anything, but the experience that I have had up to this point is the experiences I've had up to this point working with folks with advanced liver disease has certainly inspired me to continue to work with those patients in the event that future cases want to work with me because I've seen encouraging results in general. But obviously, every case is going to be different. The gist of the question is, are there options? And the answer is yes. What are those options? Obviously, that's going to depend on the case. When it comes to liver disease, I have some of the patients I worked with, they feel pretty good. They're not really suffering from a ton of symptoms. The one patient that I've saw in the not too distant past, was it just kind of got picked up on like routine imaging, not routine imaging, but picked up there was kind of unrelated symptoms going on. Happened to pick up that there was an issue with the liver on a screening on an imaging test where they were kind of looking for something else, and I was like, oh my gosh, buddy, you've got advanced cirrhosis. Like, oh my goodness, that's crazy. It was very unexpected, and he was generally feeling quite good, didn't have like a whole ton of symptoms, and then some folks are very weak and fragile and have a lot of different things going on. The liver is incredibly important. It's important, of course, for detoxification function. It's important for making blood clotting factors. It's important for hormone metabolism. It's important for blood sugar regulation to some extent. So there's number of different functions when it comes to our livers. And so if the liver becomes compromised to a certain point, then certain vital functions can start going down the tubes. So we need to be really cognizant of what kind of approach we're working with, depending on what the overall state of health is of the individual in question and where, if anywhere, they might be having some basic physiological functions falling to the wayside, such as ability to make clotting factors to clot their blood. So there's not rarely is there a one-size-fits-all protocol for any condition, but definitely not for advanced liver disease. Some of the agents that I have on my radar when it comes to working with these folks, top of the list, and well, I say top of the list, and that is very, very important in a number of cases. It's not necessarily the first thing we start with, and for some cases it might not be the most important thing, but would be arguably one of the most important things. We'll be working with phospholipids, so phosphatidylcholine, and potentially other phospholipids if it's kind of a phospholipid mixture that we might be working with. Phosphatidylcholine is really important for cellular repair, sorry, I should say cell replication. All of our cells are surrounded by a cell membrane, the majority of which is made up of phospholipids like phosphatidylcholine, and the liver, as we're trying to encourage as much liver function as possible, and maybe, if possible, if there isn't just full-blown, fibrotic changes in the liver, hopefully as much liver tissue regeneration as possible. Phosphatidylcholine can be really helpful for that. There have been quite a few human clinical trials looking at the positive impact of phosphatidylcholine specifically on livers that are under duress, whether it's from hepatitis or from other conditions that are compromising liver function. So phosphatidylcholine is definitely on my top 3 list, shall we say. Antioxidants can also be really important as well, such as alpha-lipoic acid, glutathione, vitamin E. We have to be a little bit careful with vitamin E because if there is a compromise of blood thinning blood clotting functions, then the patient's blood might already be on the thinner end of the spectrum, and vitamin E, if we dose it too high, can have a notable blood thinning effect, so we just have to be a bit extra careful there. So antioxidants can be really helpful in large part because they are crucial for the phase 2 detoxification pathways in the liver, but also because we want to make sure there's antioxidants there to buffer whatever's driving the damage that's actually causing this liver issue in the first place. So that's definitely a very common facet of a advanced liver disease protocol, in my experience. And then also making sure that we have the right vitamin and mineral cofactors for other elements of the liver detoxification pathway needs. So like methylfolate, methylcobalamin, other B vitamins, basically all of the B vitamins, and making sure we have all the minerals and trace minerals as well, because so many of those ingredients are crucial for phase 1 and phase 2 detoxification pathways, phase 2.5 detoxification pathways, and then just in general, we want to make sure that we're supporting the mitochondrial function of those liver cells. So we think about the liver like, make sure there's the detox cofactor support, absolutely, but we want to make sure we're actually supporting those hepatocytes, those liver cells, to make sure that they have enough resources to make energy so they can do their jobs. Because even if the cofactors are there to run this or that enzyme that's in the liver cell, well, there needs to be enough energy, enough ATP to actually run those processes as well. So those are some of my thoughts about liver support for folks dealing with advanced liver conditions. So again, each case is going to be a bit more nuanced than the average case, especially depending on what the state of health is like of the patient in question. But those are some of the go-tos that I think about and reach for. And that probably goes without saying. I hope it goes without saying, but we want to think about diet and lifestyle as well. Ideally eating a healthy diet, an anti-inflammatory diet, not smoking, of course, not consuming alcohol, and those types of things as well. So thank you for the question. I hope this information was useful. If anybody has any comments or questions on this topic or anything else, just post in the comment section below, and I will do my best to answer as soon as I can.